Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and Jorge André.
Hello.
Hello, everyone. Welcome to another episode of the Soft Bites podcast. Hello, Jorge André. How are you?
I'm fine. This is the first one of 2024 and the first one since we got that prize from Karma Courses. How cool was that?
Yeah, it was
We were not
surprising.
expecting that, right?
No, I was not. I was surprised that we got the nomination. I only knew about this nomination on the day that the votings.
I think I sent you.
Yeah,
I think that I sent you, right?
Or I sent you it or something like that. But it was on the day that the votings were closing, so it was just like,
yes,
okay,
exactly.
It's nice. It was this is nice. So we were already happy just for the nomination, and then to actually won. It was really cool. And you mentioned it earlier when we were talking that it's nice because it's a recognition, right? That we are not talking for the void.
Someone is listening.
And that our words have an impact, and it's nice.
Yes.
It's really nice.
Yeah.
So
when we were nominated, I was like, well, that's so cool. But then I just like, there's no way we But then when they told us that we have won that category, I was very, very happy with that. Very, very happy. And also we have a new social media platform. We opened an Instagram account, right? So we
I think it
wanted
was
to make things more professional. Yeah.
Yeah, and it's the next step. It came in a natural way. So because I think it was time for Soft Bites to have its own social media platform.
Yes.
Also for us to be able to put some parts of some small parts of the episodes, and I think it's time for that to happen. And everything has been working really in an organic way. We've been growing really in a natural and organic way. So it's been really nice, and for everyone listening, just to say thank you for listening to us and for being with us during this more than almost 2 years. I guess I'm not very good with counting time, but
I think it's probably about 2 years.
Yeah.
And if you want to know more, if you want to spend some time with us, if you want to dig deeper in these ideas and these concepts, it is in March, right? When is it, like, the course?
Yeah. The next edition is in March 2021 of March in Sagres, and where we go deeper in all of this. So in the emotional awareness, emotional intelligence part, and dentistry, but also the systems and protocols that you have to have in order to work with I guess with awareness, right? Where you feel a little bit in control.
Yes, it's true.
Yeah, and to feel a little bit in control of your practice, so that you have time for creativity and to develop other parts of dentistry. And we are going to talk about that part of that today, because communication is a big thing in a dental clinic, and one of the things that you teach on your system, the system that you have for your for your clinic, is that you have to have a written communication in dental clinics. And we were talking before we start recording that I think that every dentist already gone through the situation where you open a patient chart and you don't see anything written. So the patient was there, you know, the patient was there in an appointment, but then you don't have anything written. And in countries like England, in the United Kingdom, for example, you don't have that anymore for
Yeah,
legal reasons. So colleagues are
yeah,
very strict and obliged to write everything from the consultation. But in other countries, countries like Portugal, even in Belgium, the reality of Belgium that I
yeah,
know also, I know that you don't have to be very strict with that. It depends of the policy
yeah,
of the dental clinic. So I think it's very important that we talk and we give some tips for how you can have a more efficient written communication in dental clinics. And first of all, and I think that's my first the first thing that I would like to hear your opinion in is, I mean, we know it's important to have written communication. Um, why do you think that that still doesn't happen? That still is not something that clinics have as uh, an
standard.
established
Yeah,
protocol? Yeah.
yeah, yeah. I think that this is something that I think that even in 10 years, if we talk about this, it can still be a problem. You know, I think that dentistry is a very technical, hands-on um, activity, right? So dentistry is about fixing teeth, treating cavities, doing implants, doing procedures, and sometimes and that absorbs us so much. Even today, for example, I was finishing my appointment, so I saw two patients in the morning, and I saw two patients in the afternoon, and I only filled the the clinical record at the end of the day, and I'm very strict with that. I'm very strict with me and my team. We are very on top of that. We try to be very on top, and this is something that we really, I mean, for years, I mean, it's part of our DNA of being very strict with the records. But so the question is, why have I not written down the notes at the end of the first appointment, at the end of the second, at the end of the third, and at the end of the fourth? Why was that? Because I want my mind to wander elsewhere in between appointments, right? I want to go to my cell phone. I want to go to stretch. I just want to get my head out of that small micro environment that I've been focused for the last hour, isn't it? I just want to zoom out, right? Because it's, let's be honest, you have to be mentally tough to be like doing an impression over implants that you need maximum attention on a very sensitive patient, and then you just then all the pressure is gone, the patient is leaving, you say goodbye, and then you have to force yourself to write down exactly what you did. I mean, that's quite kind of violent, let's say it, isn't it? Or because you just want to let things go for a few minutes and get ready for the next patient, which is important, right? Which is very important. Um, but I think that is the reason. I think the reason is that it's not because dentistry is so, it's such an in-depth focused procedure that you just want to zoom out when the patient goes. Well, you can have this method, which is to fill the clinical record at the end of the morning or at the end of the day, as I do. But sometimes then you reach the end of the day. Oh, I'm just tired. I'll just forget about it. So the reason is because it's just you just have to be very disciplined, and dentistry is a very focused uh, activity, and you just want to zoom out, you want to let it go, and then sometimes you are tired. which is completely different from, let's say, for a general practitioner, that you have the patient in front of you or by your side, and as the patient is talking, you are writing the clinical records. I mean, the clinical records is the appointment, right? And for us, the appointment is the technical procedure, right? The clinical record is something that you have to do, and you, like an extra thing. At least that's the way that we see that. But this is, I think, that why that happens. This is the reason why. But having said that, I have to say that we've been very strict with that. It doesn't mean that we don't have failures, but we try to track those, and it's part of the culture of my team to be very, very specific with that. For example, there's no way an implant can be placed without we know exactly when it was placed, the torque, the kind of abutment that was on top of that. There's no way that you place a crown without writing down the material, where was the lab. There's no way to do the restoration without writing down the composite and the bonding procedure that you did, or something else. Some of the things are really important. For example, let me give you a very, very, very specific example. A patient comes in, deep cavity, you do a restoration, and you want to be conservative, and you want to tell the patient, look, I'm just doing the restoration. I just did some pulp protection, but and you just probably need to take some um, painkillers or non-steroid anti-inflammatory, just to see if things go away. And if that doesn't happen, then you may need to do the root canal treatment. So this information is very important that it is written down in the file. So we have warned the patient, so the patient paid something, and then we have warned the patient that this tooth may need the root canal treatment in the short term, maybe in the next weeks or something. Let's see, you have to explain that to the patient. So it is as important, the explanation that you give to the patient. You have to explain, look, we want to be conservative because if you do root canal treatment, of course, there are some disadvantages. The tooth will be more fragile, etc., etc. But if it's needed, then we'll have to do that. So it is as important the conversation that you have with the patient as it is important the notes about this conversation. Why is that? Because if the patient comes in next week with a big pain, um, if you did not warn the patient, of course, the patient will believe that you did a bad job. Okay, but let's suppose you warned the patient. Then you warned the patient, but you did not write that down, right? And let's suppose someone else is seeing the patient. If someone else is seeing the patient, there will be a problem now, which is, will the patient be mad at us because we will be charging for it? So he came here, he paid for a restoration. Now he's gonna pay like 4 or 5 times more for a root canal treatment. I mean, was he warned about that? And then this creates an uncomfortable situation. The doctor that is doing the procedure in the team. So if the patient was warned about that, and if you wrote that down in the file, then everything will be smooth, right? You just tell the patient the cost because it's an emergency. It was not a planned treatment. So you have to ideally warn the patient, of course, in the beginning of what you will charge. Because, for example, Manuela, I think you should, in the first appointment or in emergencies appointments, if the price is above what is reasonable for a dentist, which means like what is reasonable for the single restoration or something. If the price on an emergency or on the first time, if it is a little bit more than what we consider to be reasonable, the patient should be warned before the procedure starts. In subsequent procedures, when everything was planned, it was given to the patient. The patient knows exactly what he's into and what he needs to pay. But if it is an emergency or the first time, you should tell the patient before you start the treatment. So, in my opinion, the doctor should talk about that, or the nurse, or whoever. But that's just a very, very, very simple and very straightforward example. I mean, if you do like a deep restoration, you need to let know the patient that you may need to do a root canal treatment. Write that, tell the patient, tell the reasons why all the benefits of what you have done, of the more conservative approach that you have done. But you have to write down what you said, even for to avoid any awkward situations. of whether we or how we should charge the patient for the root canal treatment. This is a very typical example in practice.
Yeah, I think, and you already mentioned this, it's because if it's not written, it doesn't exist also. And it's also to avoid a
Yes,
situation that is the
yes,
patient word against your word. So it's like a situation where
yes.
it's like
Also,
a blaming game. If you have everything written, that will not happen.
absolutely
And let me ask you something. What do you think about consents? Because we know that consents, there are treatments that
interesting.
demand consent, but do you think that it will happen for this kind of situation also? So everything that, because it's what you are, what we are talking about, it's kind of a note, right? So it's on the program and it's on the
Yeah,
clinic, but it's a note. You can write something, and you
yeah,
didn't even
yeah.
said it to the patient. Do you think that this kind of situation, like the simple ones, even the simple ones, the one that you just described, you should print the paper and the patient should
Yeah.
take that with them? What do you think? Is this is going to happen in the
I
future, do you
think
think?
I think that in the future this is exactly what's going to happen. I think at this point in time, when we look at countries that are much more evolved in this way, like the UK and US, I mean, it's unthinkable to do an implant surgery or even endodontic treatments without informed consent. It's unthinkable to think about to even consider that because the the there's lots of lawyers and there's a lot of how do you call it uh, there's a lot of issues with the dentists being sued. There's even lawyers. There's even groups of lawyers that are
Specialized
specialized in
only in
certain,
suing
yeah,
in
in dentistry, suing dentists. Of them, they work with dentists or suing cardiologists and stuff like it. So these sorts of countries like the US, like the UK, eventually Canada as well, I think those will be precursors of something which you just mentioned, which is like even in these simple cases. And I think that technology will play a huge role here. I think that you will have each practice will have a way of communicating with the patient. The patient comes to the practice and he knows exactly what went to in his app. He knows exactly what happened in the appointment, what was the material that was used, what a resume of the conversation with the patient. I think that AI will help that a lot. AI, and I was even talking about with Alok recently. I mean, if you have something, I think that in the future you will have. The patient is in the chair, you are with the patient, and there is like a recording device recording everything that is going on in terms of communication. And at the end, that AI will deliver a summary, a written summary of everything that was said. And I think that the patient will have access to that, and that will serve for legal purposes and stuff like that. Not only for communication. I mean, first and foremost, I think this protocols and then these systems of written is to serve the patient's best interests and of course to serve the practice best interest, to bring some truth and to bring some organization and to bring some sense of everything that's going on. So that's the first thing. This is communication, and everybody wants transparency. So it would be cool if you went to the dentist and just get an immediate report in your email or whatever of all the materials that they used, of what was the conversation and everything. That would be very cool. But also, it will serve, of course, for legal purposes. I don't think that for small things you should give informed consent. But I think that we are moving towards a situation where technology and AI will basically do a summary of everything, and we'll have that presented to the patient in the form of an app or an email. I'm 100% sure of that, and that is cool. Sorry, that is cool. I think that everything that brings transparency and accuracy and truth is always bringing more kindness and more. That's what I think. I understand that also. You you may be a little bit more. I understand that you may lose like the human side, like the natural trust that you should have in a human being. I understand that, but I think if we balance things, I think at the end of the day we'll be able to work more relaxed. The patient is more relaxed. We are more relaxed. I mean, it's just like the cryptocurrencies. I don't know what's going to happen, but if you in the future where everybody plays with cryptocurrencies, so if you buy a fridge, you pay with cryptocurrency, and in that contract, it was written that if the fridge stops working in 1 year, you'll get a refund, and everything is done automatically because that is the way that the cryptocurrency would work. I mean, I think this is the same thing. It's about bringing transparency to this human transaction, to this medical transaction. But absolutely, I think that in the future everything will be automatized. I think it's going to be sooner than we believe. But I don't think at this point we should like for that simple situation of a deep restoration. I just think that just writing things down and letting the patient know and writing things down that will be more than enough. Yeah.
Okay, so we talked about the simple cases, and we talked about the basics, right? So you should write what you the procedure that you did on your clinical records. But let's talk about when you have big treatment plans, and you
Yeah.
have that, and you work with a multidisciplinary team. So here is
Yeah.
where written communication is really, really, really important for you to have a
Yeah.
good working
Yeah.
flow. So tell me how
Yeah.
in a big treatment plans, and how do you handle things? How do you make written communication efficient, for you to be able
Yeah.
to not to,
That's
yeah.
Yeah, that's a very interesting question, and I think that we've discussed this in previous podcasts randomly, but I think it's a very very important topic, and I think that dentists should really be aware of a few things. First of all, you said, like, oh, well, you work with like big treatment plans. Yes, I do, but every practice does now. Every practice now works with. I mean, if you have a case that you have ortho in adult where you need to place some implants, a few restorations, and some grafts. I mean, it's very, very common that you have a 30 or a 40 or a 50 or a 60-year-old patient that needs orthoperioprosto and something like that. In any small practice in most of the countries now, this is happening. So this is not something that you can either say, well, I want to be only doing like restorative dentistry in my practice. It doesn't happen because referrals between practices are just gone in most of the countries. So you will have to deal with the patients that will have to go through several different dentists in your practice. I think that is a given today. I mean, your patients, many of them will have to go through several different colleagues, right? And if it is you and your husband, if it is you and your sister, you and your father that works as dentist, everything becomes easy, right? Because you naturally talk between each other, and I mean, communication is easy. You understand that the business is a common business, right? So everything is easy. Um, the situation is that most of the cases are not like that. You will have colleagues that work with you, and you will have to discuss treatment plans with that colleague before presenting them to the patient. And you will also have to be doing some sort of communication throughout the treatment, right? So, first of all, you should never give a treatment plan to a patient. Let's say you are a general dentist. Look, this is going to cost X and X. You're going to place an implant here and there, and perio there, and ortho there, without talking to the orthodontist or the periodontist or the implantologist, because the case may not be very simple. So this means that you will very likely need to collect data in an appointment and then present a treatment plan in a second appointment. So, what happens between that initial examination and the plan presentation? Between that initial examination and the plan presentation, what happens is that you will have to talk to your colleagues. You gather the data, CBCT, X-rays, photographs, patient motivation, initial examination, all the clinical examination, everything, and you will have to talk to the periodontist, the implantologist, and the orthodontist. Let's say. So this brings the big question: is how do these 3 or 4 people talk together, right? And at first, you may think, well, let's do a meeting. Let's do a weekly meeting on this, right? And this is what we call synchronous communication, which means that everybody is available online or offline at the same time to discuss that case. And I find this very good. The problem is, I don't think this is possible in most of the situations
It's not
because
realistic, right?
everybody is not realistic. Exactly. That's the best word. It's not realistic because everybody has their own timing. Everybody has their own life. And if someone goes on vacation, they will have to stop their vacation to be talking to be in that meeting. And today I'm not even talking about being in presence. It can either be online. But in synchronous meetings where everybody needs to be present at the same time, online or offline, this is the problem. It's not realistic, right? So, and you may say, well, but that is best because we can communicate with each other. We can, of course, we can see each other, and anything that arises will be dealt immediately. That is correct. But as you say, it's not realistic. So, what would be the alternative? The alternative would be to communicate in a asynchronous way. And this is, I think that sooner or later, every practice will realize this is the only way that they can actually communicate. So, but communicating on an asynchronous way means that everybody needs to be very clear, very objective, very specific, and using what we call templates of communication, of protocols of communication. What does it mean? It means that I need to be very objective when I ask something. I need to make very productive questions. I need to be to not complicate things further. And this, of course, this means that there needs to be some simplification. Let me give you an example. What I do in my practice is this. First, let's imagine a case that has orthodontic treatment. Of course, I want that the orthodontist says, look, I will need to study the case and I will need to do my own examination, but I believe this case, you can already give him or her an interval of prices. That's one thing. Or they may say, well, really need to look further into this case, so please book an appointment with me to realize, because I don't know if you will need to extract teeth or not extract, if it is an orthodontic case or not, because that changes everything, right? So they book for the orthodontist to do their initial examination. But whatever the case, once you have the final or the provisional opinion from the orthodontist, we always divide the case in 3 stages. First of all, what happens before orthodontic movement. Second, what happens during orthodontic movement. And third, what happens after orthodontic movement. And you see, it's such a simple way of clearing things up, but it gives a structure to the conversation. It gives a structure to the treatment plan. It gives a structure for patient communication. So this is what's going to happen before the orthodontic movement. This is what's going to happen during the orthodontic movement. And this is what's going to happen after the orthodontic movement. So before the orthodontic movement, we are talking about perio, hygiene, treating caries, root canal treatment, some more extractions, okay? And then during the orthodontic treatment, then you'll start the ortho treatment. And during the orthodontic treatment, we may need to do some provisional restorations. We may need to place some implants during the ortho, some provisionals over the implants. And after that, then we have the aesthetic rehabilitation. We can place the crowns over the implants, and then you can go for the veneers that can be in composite or in ceramic. Notice, if you notice, the way that I explain this is in a way that almost every patient would understand, number one, and that would give a structure for the communication for the team. So what happens before? What happens during? And what happens after? Usually these are the things that happen before, during, and after. Okay? So the team is calibrated more or less in the structure of the treatment plan, which makes communication easy. I can send an email, say, for example, hey, Luis, what do you think about this case? Do you think it's going to need a sinus lift? Oh, yeah. And it says yes. And then on the treatment plan, each of us fills their own parts. So there's one person that is responsible for the treatment plan, and we use Make Me Clear, but you can use a Word document, and he divides that in stages, and then each person writes down their respective things and their prices for everything. And that communication is done through email. Usually I send an email to everybody. So look, I'm gonna have this, in this case, I'm gonna have this and these questions. I just open the treatment plan on Make Me Clear. You can go there and fill your part. When everybody's ready, just let us know, and then we'll present the treatment plan. It's usually not me, it's someone else. So there is a person that is responsible for doing initial examination and presenting the treatment plan, right? And that person is responsible for communication in an asynchronous way with the rest of the team. And I think I don't see any other. And ideally, yes, if we could stop our lives and be all together and talk about the treatment plan, that's something. But that would demand that everybody would stop their lives after work most of the times to do that. And that is not reasonable, that's not possible, which means that they will get back to me when it is a reasonable time for that. And of course, we always set a time limit, like 1 week or 2 weeks, depends on the case. We have to present this treatment plan for the patient. So we have the timeline for that. So this is basically what I believe. Yeah.
That's one of the things that I had here to ask you, and you already answered. It's how long you have to make this treatment plan as a
you
team.
You cannot prolong that. In my practice, 3 weeks was sometimes for ortho 4 weeks.
It's very interesting because what you just described, that way of working in a synchronous way. If every clinic think about it, they already work that way with the lab. So they communicate with the lab in a synchronous way through templates and through as much detail and narrow communication as you can, as much information, photographs, etc. that you can. So I think that dental clinics already know that way of communicate with the lab. They know how to go how to do it. They just have to adapt it in their own functioning, because I think that idea of the team getting together and talking about this, I think there's still that idea, but then it's just like you said, in a realistic world that does not happen. So if you can establish the same way to communicate as your lab with your lab as for your team, you have that kind of communication that you just said. So in that, it's very important what you said. So template. So what you were saying is that for you to have this kind of communication, you have to build a template in order to be a structure, in order to be able to be easy for all the team to reach the treatment plan in those 2 weeks that more or less that you mentioned.
We usually what we do is that we do the initial examination, the checklist. We scan that, goes to the Dropbox, take photos, go to the Dropbox. So the initial photos are 4 or 5 photos. You don't need to do like a full protocol yet because you don't know if the patient is going to accept or not. So basically, like a face photo in rest in maximum smile, then intraoral, side, left, and then occlusal ones, and then just slightly open to see the wear. That's more than enough to create a treatment plan. See if there is like a centric relation, maximum intercrospation difference, and then a CBCT or an X-ray. So everybody has access to everything in Drop. So today it's very easy with clouds, right? The thing is that I think that the mindset there's a mindset that needs to change. The biggest thing, which is um, first of all the asynchronous way of communicating. So I'm sending an email and you answer me when you can. Uh, but I think, and we talked about that, which is today we talked about this many times. Your work as a dentist does not end in the chair side with the patient. There's a lot of stuff that you need to do. And of course, that you are, if you are a practice owner, even more. But even if you are not a practice owner, you need to spend sometimes half an hour, 1 hour a day. I would say half to 1 hour a day. I would say maybe 4 to 5 hours a week uh, communicating with the lab if you are in restorative dentistry. That's very common. So you need to change that mindset and you need to add those hours to your working schedule because those also wear you out, right? Because let's be honest, when are you going to do that? At night, right? That's
You're going to
and
do it
you are
at
still in time.
night,
Yeah,
on the weekends. You're going to do it sometimes within patients, like you
yes,
said, those times maybe when you need to clear your mind and to disconnect a little bit in
yeah,
order for the next patient to be focused. Some colleagues do it in between patients, and
yeah.
but yeah, it wears you out. It contributes for you to be
It wears you out.
yeah,
This is why
exhausted.
I'm a big fan of not seeing many patients, and we have those. And there's a lot of things that changed throughout my professional life. Seeing less patients was one of them, but the other one that we have on a recent podcast was healthy working hours. I mean, you need, and especially as you get older and as you get to more and more complex cases where you need to send a couple of I mean sending an email is never only 1 minute. How many emails do you think it's 1 minute and it ends up by stealing you half an hour, isn't it? So at that 5 minute for the email, it's never a 5 minutes, half an hour, and someone is waiting for you to watch Netflix, and then they you just take time from your families and your friends and from yourself. So the reality is that you're going to be spending time at night or in between patients, or if you are a very um, organized person, you wake up at 5 a.m. or at 6 a.m. But then if you have kids, it's impossible. Or if you are taking care of someone, if you have your parents that you need to take care, if you had to take the dog for a walk, whatever that is, I mean, it's never easy. So there's only one answer, which is you need to reduce patient time to be able to accommodate these things. There's no other way
Yeah,
because otherwise it'll
and
just be accumulating and accumulating.
you need to consider that work as part of your work as much as clinical work, as you seated working inside the patient's mouth, because it will make all the difference on your work, the one that you are performing
Which
inside of your
which
patient's
bring
mouth.
us which bring us to a very, very, I would call the beginner's mistake, which is the WhatsApp culture.
Yeah, that's
WhatsApp
it.
for everything.
Yeah, that's it. I think it's nowadays it's. I think that WhatsApp,
Abusive,
and it's not only WhatsApp. It's
pervasive,
there are a lot of other.
everything. Yeah.
You can have a group on Messenger. You can have a group on iMessage. So it's
But
all this
by
digital.
the way,
Yeah.
let me ask you a question.
Yes.
I'm sure there are some people, and I know that I'm sure that I'm included, that there's no that you would answer as soon as you can, probably, right? But I'm also sure there's a group of people that you don't mind not answering for a week or two. WhatsApp. I'm talking about WhatsApp.
I think we all have that. Yeah. I
But
think
that is
we.
that is not bad, is it?
Yeah,
Imagine if you would be completely available for every WhatsApp message in your life.
no, it's becoming very yeah, overwhelming. And like I told you, it's not only WhatsApp.
I
It's
don't know in your case, but for example, you have mindful students, right? You have like courses that you coach students, right? And of course, I'm sure you have a very close relationship with them,
but
right?
I
Because
have a rule. I have a rule that
okay,
is the the communication is through email. I give my number, but it's only for, and I make this very clear. So
emergencies.
yeah, it's only for emergencies. So like for example, if you have some kind of imagine that I have a meeting with someone and something happened and there's an
Oh
emergency
yes, I
and he has to
yeah
reschedule. So if he feels
yeah
more comfortable, he can just send a WhatsApp.
yeah
But even in those cases, I make clear I prefer email.
yeah.
And look, for example, I'm going to give you an example. I don't have WhatsApp on my PC. So I don't consider WhatsApp to be
Neither
a
do
work
I.
tool.
Yeah.
I don't
Oh,
consider
yeah, I
WhatsApp to
agree
be a
with
work
you.
tool. So
Yeah.
everything that is sent to me through WhatsApp that it's work related, I I confirm that I receive it, but I say to the person, can you please send this through email? And next time send
All
it
right.
through
That's a
email.
very nice one. Very
Because
good.
and I can even say, look, I don't have WhatsApp in my PC, so can you please send me this through? I appreciate it, can you please send me
Otherwise,
this through email? And next time send it through email because work related. I
otherwise I might
always
forget.
yeah, yeah, it's becoming overwhelming, and also WhatsApp. I mean, record wise, I am. For me it's not
Searchable.
no, no, no. So I don't I work through email, or I work through Google Drive. I have some information
Yes.
also in Google Drive,
Exactly as
but
me.
I work through email. Otherwise, I completely, and because I'm not used to use WhatsApp as a work tool, I forget it. So it's not something that I use. But I know that WhatsApp nowadays is used for work, and I know that some clinics, for example, have a WhatsApp group, but I don't know. But and I'm not the person to say that. I don't know if you have a WhatsApp group on your clinic, if you discuss work
Yes.
on that group, or if it's just the simple
Yes.
things on, or if it's a work tool. Do you have WhatsApp as a work tool on your clinic?
Well, that's we have a few policies. Actually, it's very interesting about you that question. Uh, Number one, except extreme emergencies, no one has the obligation to see or to answer any email or WhatsApp after work. No one has that obligation. And my advice would be not to do that. After work, not to do that. Unless there is like an emergency or something. If there is like not to send something to the WhatsApp group, unless that is an emergency. I mean, if for example, if I am sick, I won't be able to go to work tomorrow. I'm just leaving a message in the WhatsApp group. Or sometimes if the patient has been confirmed, I just go to the schedule app, and I myself go to the first or second patient and send them a message. But I never want my staff to be working to feel obliged to see or to answer any sort of working WhatsApp or emails. That's one thing. Another thing is whenever I send an email, if it's after hours, I try as much as possible. So, first of all, with the first rule, if you get an email, you don't need to worry about it unless the next day. But even still, I schedule, and Google has that function, Outlook has that function. I schedule my emails to be delivered on the next day in the morning. That's another thing that I do. Also, on the emails, on the footnote of our emails, it says something like, we care about the health environment, the wealth, the mental environment and stuff like that of the practice. So please do not feel obliged to answer to this email. I can even read it to you. I'm going to read it to you what we have here. So, we respect the time of all our patients, colleagues, and partners. Therefore, we do not expect this email to be answered outside your working hours. We have this email in every, we have this footnote in every email
Communication.
of the communication, every, right? So um, I think this is very positive. I think this creates a very um, relaxed, relaxed in the way that, well, we are needed to be focused when we are needed to be focused, not when we are not needed to be focused.
And it also create
And we talked
boundaries.
about create boundaries, today I was thinking about that. Newer generations, they are very sensitive to this stuff. They need to be, and rightly so, they need to have predictable um, schedules to leave the practice, to go to concerts, to go to their families, to go to their boyfriends, girlfriends, house spouses. They need that sort of, they need that social part, and I think it's very important that they feel that you care about that. Yeah, but WhatsApp. I want to go back to to the conversation that we were having regarding. I don't think we should say yes to everything. I don't think we should. And I understand that if someone sends you a WhatsApp, it might be a lack of respect not getting back. I understand. Um, but on the other hand, there's only so much that you can do. I don't think it's a crime if someone, I mean, if it's an ongoing subject that you have been dealing with and that was an ongoing conversation, that's one thing. But if someone texts you out of the blue in WhatsApp regarding this or regarding that, I don't think, I think we should not make a confusion between the culture of being professional with if that will easily cause a burnout or a overwhelming feeling in you. I mean, if you are overwhelmed, you don't need to be answer WhatsApp in between patients. You don't need to be answering WhatsApp at the dinner table. It's okay if you are with your family, with your kids, with your spouse, with your wife, with your husband, and not answering the phone and not answering the emails. Yeah, I think it's okay. I don't see that
Because
there is a
otherwise you're
problem there.
always working, huh? You have the that
Yes,
feeling that you are always that we are always working. And I know about some colleagues that they have the just like a WhatsApp group of the clinic
the
and
practice. Yes, yeah.
of the practice. And for example, when they are on holidays, it gives them anxiety, and
No,
they would
they
prefer
shouldn't.
to
Yeah, no.
just silence, but they don't want to silence because they might be
Yeah,
misinterpreted.
I
I
forgot.
think that also
Yeah,
those rules are very important to be
yeah,
defined, and in order for their as healthy
yeah.
boundaries. I think that's very important.
And but I think that you should be reasonable when using that. And WhatsApp is when I want to send something that is not urgent, that does not need to be registered, does not need to be registered. This is where I use WhatsApp, something fast, or for example, I am late. Please let the patient know that I am late. Oh, this is the image that I was talking to you about placing that painting on the wall, and these are the measurements here. So it's never like something that needs to be recorded, that needs to create evidence, like you're saying. I mean, there's this very nice image that we have posted several times, which is there are two people talking, and one says, "Well, you always send email. Why is that? WhatsApp, it's easier. WhatsApp, it's faster, right?" And I always find that funny. WhatsApp is faster, it's easier because there's this culture, right? And the only persons that say that are the persons that have not yet been overwhelmed, that that did not have to manage a business or to manage a practice. Because if you had, you understand that does not make sense. Because email is the standard of communication for professional situations because there is a record there, there's a registration there, and it's just a standard, right? The WhatsApp is just for less um, less
Less
urgent
important.
and things that don't need to be documented, right? Yeah, and sometimes for
True.
fun as well. Sometimes
Yeah,
for
yeah.
fun.
I think it's a lighter way, right, of
Yeah,
communicating the less important things, and even for lighter way, sometimes it's even for people for joking, and sending whatever memes or whatever.
yeah,
Even on those situations, it can feel overwhelming. When you have a group and you go and have like 100 messages that you didn't read. So, oh my God, what happened here? And then you go and you're, okay, I don't have time for
you just
this,
it's now it's too
Yep.
late. Now it's too late to
Yeah,
get
yeah,
into the
yeah.
conversation.
Yeah, 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 yeah.
Yeah, I know
So
exactly what you
yeah,
mean.
so it's not a working tool, and it should not be. I mean, we are talking about less important things. I mean, can you imagine treatment planning in a WhatsApp group?
No, it's no. There's no way. There's no way.
And
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 live communication through a WhatsApp as well. I mean, I heard this idea, which is, but I think even still it's overwhelming. There was this lab that says, well, we open a WhatsApp group between our dental technicians in the lab and the doctors in the practice. We open one WhatsApp group per patient,
per
per
patient.
case. Do you understand?
Mm-hmm, mm-hmm.
So there's a
Yeah, but
case of a
that's
patient, they open a WhatsApp, and I understand, but then can you imagine the amount of, I mean, then in your WhatsApp, you'll have the name of the patient, the name of your girlfriend, the name of your husband, the name of your uncle, the name of your father. I mean, how messy is that? So I don't see a point. But I mean, if it works, it works.
mm-hmm.
But there's one thing that I would like to go back, which
Yeah.
is when we talk about asynchronous communication and email communication. Um, there is this very nice book that I've talked several times from Jason Fried and David Hansson from 37 Signals, which is a very small company that created a software called Basecamp, and they make millions every year. And it's a very and their culture is very minimalistic. I mean, they have these mottos like "We are not family," some things like that. That you should prioritize sleep, that you should go for asynchronous communication as much as possible. Rework. It's a very, very nice book. Very, very light book to read. Rework is an amazing, amazing book that talks about the new strategies and philosophies of working remotely and the remote communication. One of the things that they say is that for them, it's very critical that the people that they hire are very familiar, very confident, and very objective, communicating in an asynchronous way through email. So, because some people write without, I mean, sometimes you read an email and you say, what the hell is this? What is this person asking me, or is this person telling me, or is there a clear instruction, is there a clear question, an objective question that I should answer, or is there a clear instruction of the things that I should do? And sometimes I send an email and say, look, call this patient and ask him this or that. If he says this, you do this. If he says that, you do that. I mean, very clearly, something very clear. And that capacity of being objective and specific, it's very important. I mean, the people that you hire, they need to have this capacity. Now, sometimes for older colleagues, they, because of all the reasons that we just said, that dentistry is very technical, not that much of writing things down. Sometimes some colleagues, they are used to work in a way that is not like that. And it's difficult to ask someone that is not used to working that way to sit down and write something. I have colleagues that the only way that they can communicate with the lab, they just say the color of the tooth, and then I will call you. I mean, that's chaotic today, in these days and age. I mean, I will call you. So it means that we will need to find a common ground in terms of schedule that we both need to communicate. And that it's stealing life from you and it's stealing life from me. So that book, Rework, is a very, it's very interesting because he wants to to show how you can optimize as much as possible remote work, remote communication, asynchronous communication. And he says, seems like, for example, there are some expressions in emails that are poison. For example, ASEP, as soon as possible. That is poison. This is poisoning the communication. The as soon as possible is poisoning the communication. Um, I mean, if there is a one as soon as possible once a year, that's one thing. But if there is one as soon as possible every week, there's something wrong, right? So it's very important to be very effective, very specific, and very organized in terms of communication because you want to save time. You want to save your time and you want to save the other person's time because at the end of the day, what we all want, we want that things go predictable in a predictable way, go smoothly, that we finish on time, we go home, we are with our families, with our loved ones, we sleep early or we sleep whenever we want and we get our due rest and things just go on a predictable way. Otherwise, it's just chaos. And this WhatsApp virus today that everybody texts you at any time and sends you 20 reels a day and sends you 20 memes a day. And I have no issues in not seeing some images. I have no problems in not answering an email if I am with my friends or not answering a call if it's not something urgent. And I think that the constant availability for everybody every time is a lack of organized ideas and or an organized life. And you just have to say no to some of those things. And if you can implement that policy in your practice, all the better. Yeah.
Yeah, but you can only yeah, you can only achieve that, and you can only if you have a good system in place. And
Yes.
I think that's
And
what
the
you said.
culture.
Yeah, and
Yeah, all this.
and
Yeah, all these things they come down to the culture. Yeah.
okay, I'm going to leave the book and the authors in the episode notes. I already took note of it, and and I think that's, and we already said in another episode, if it's not written, it doesn't exist,
Yes.
and
And
dentistry is
another one that
already.
I've heard, another
Mm-hmm.
sentence that I've heard from Ray Dalio, which is, in the end, being specific is a form of kindness.
Ah, that's nice. That's
That's so
nice.
nice, isn't it?
Yeah.
In the end, being specific is a form of kindness because it is. You are bringing clarity and truth
Mm-hmm.
to the relationship, isn't it? You are being
Mm-hmm.
kind. The more specific you are, the kinder you are being.
Yeah, yeah, and it's so important, and it shows respect also. Show respect for your
Yes,
colleagues, for your
kindness and respect.
patients, for the staff that you are working with. So I think it's very, very, very important. I don't know if you want to
Oh, and
add
that was
something
the
else.
first podcast that we record in 2024. That was a good
Yes.
one.
Thank you again for the ones listening, and just to again remind you that in March 21, 22, and 23 of March we'll be in Sagres. If you want to join us, and if you want to learn how to apply all of this, for example, this type of communication with the templates, you give all the templates that you have for yourself and the ones that you use in your practice. If you want to learn how this kind of leadership and how this kind
And
of communication, yeah,
more about mindfulness, more about awareness, more about the
yeah,
meaningful
self-awareness, the
ways that you can.
yeah, and to change a little bit of your mindset, right? Because you mentioned that that's it. Sometimes you need to change a little bit of your mindset in order to implement some of these ideas
Yes.
that we bring to the table. but we can promise you that will make your life much easier as a dentist. It will make your life easier, and it will make your life clear. It will give you a clear vision of dentistry,
Yeah,
and it will make you
absolutely.
a little bit happier also on your as a dentist and as a professional. So thank you, André,
Absolutely.
for your time
Thank you,
and for this
Manuela.
conversation. And we'll see you on the next episode. Thank you, everyone, for listening.